Welcome to Sexy in Your 60s. This is a space for women 50 and beyond who are choosing to live with vitality, intention, and joy in this chapter of life and the ones ahead of us. I'm your host, Dvora and Slant2Plants, registered nurse, national board certified health and well-being coach, and Plant Strong advocate. On this podcast, we explore what truly helps women thrive in midlife and beyond through evidence-based health insights, real stories, practical strategies, and the deeper sense of meaning that makes life feel rich and connected. I intentionally chose the title, Sexy in Your 60s. When I use the word sexy, I'm not talking about sexuality or how we're seen. I'm talking about energy, confidence, presence, curiosity, purpose. Sexy is how you feel in your body. Sexy is how you move through the world. Sexy is knowing who you are and choosing how you want to show up. I believe this stage of life isn't about winding down. It's about waking up. Not in your 60s? You're still invited to join us. Each episode is designed to support you not just in how you live, but in how you feel in your body, your relationships, and your life. I'm so glad you're here. Let's begin. I met my guest today at the International Plant-Based Nutrition Healthcare Conference in September 2024, where she was on a panel. Something about the way she talked about food, metabolic health, and what it actually means to help people change got my attention. I had been following her before that, but meeting her in person sealed it. And here we are. She is a registered nurse with over 27 years of experience, a certified diabetes care and education specialist, and a diplomat of the American College of Lifestyle Medicine. She is the owner of EmpowerMe Diabetes Health in St. Petersburg, Florida, where she uses plant-predominant nutrition, gut health restoration, and lifestyle medicine to help people with diabetes, autoimmune conditions, and complex medical disease get to the root of what they are dealing with, not just manage the symptoms. She also works with Mastering Diabetes and contributes to the Moving Medicine Forward initiative. What I find most compelling about her is not just the credentials, it is the conviction. She believes that food is medicine and that the body can heal in ways the medical system often does not tell us are possible, and that real change begins with knowledge, support, and the willingness to trust yourself. Please welcome Jacinda Shapiro. I'm thrilled to have Jacinda as a guest on Sexy in Your 60s podcast. Thank you, Jacinda.
Dvora, thank you so much for having me today. I'm really excited to be here.
So, do you remember what your topic was when you spoke at the International Plant-Based Nutrition Healthcare Conference where I first met you in person?
Yeah, the Plant-trition Conference. I actually sat on a panel with Dr. Michael Clapper, and it was just open comment for people to ask questions.
Do you remember what were the most common questions people asked?
Most, including plant-based providers, are often confused about exactly what is driving insulin resistance and how can we really best help people to reverse it so that they can reverse type 2 diabetes or reverse prediabetes or work on polycystic ovarian syndrome or ulcerative colitis and Crohn's disease, and also help to optimize their own health. Fat is a huge driver. And unfortunately, we have too many vegan food options that are also loaded with a lot of fat and a lot of sodium. Sometimes our whole food plant-based providers still consume way too many nuts and seeds and coconut, different things that actually drive insulin resistance.
Oh, I love that you're going to give us the truth about a lot of things that people, they really don't want to hear. For so long, we've heard moderation is okay, moderation is the way to go, but that's not really the truth for everybody. I'm looking forward to hearing you describe a little bit more about those scientific processes. I'm going to back up a little bit and talk about your background. You're a registered nurse with over 27 years of experience. You built EmpowerMe Diabetes Health. Talk a little bit about what got you to that decision, and what were you seeing that made you say, I need to do this differently?
My experience on a plant-based journey is personal. My middle child came into the world pretty small. He was diagnosed with failure to thrive by the age of 7. My late husband was an orthopedic surgeon, and we just couldn't control his eczema. We couldn't control his asthma. He had asthma episodes as he slept at night. We had to keep the nebulizer out on the counter. And every medical doctor we took him to see, including friends of ours, he just got worse. We read the China study, and it changed our life overnight. Ironically, we were actually doing keto at the time. We lived in Texas. 3 months on that diet, our son, his eczema was gone. He didn't have asthma episodes. He was able to grow and begin to thrive. We had spent so many times chasing ear infections, bronchitis, pneumonia. I lost count how many rounds of antibiotics he went on. When we went plant-based, I thought it was just going to be for him. But I had been living with high blood pressure and high cholesterol, and I blamed my dad for it. I've always been thin. I've always been active. I thought I ate a pretty balanced and healthy diet. So I thought it was my genes. But I haven't had an issue with cholesterol or blood pressure since being plant-based. I'd been diagnosed with lupus in my 20s, and within a year, I normalized my titers. My father had colon cancer, so by the time I was 40, I had to start colonoscopies, and I had precancerous polyps. A AAA, which is an abdominal aortic aneurysm, killed my great-grandmother. My father's aneurysm was 8.3 centimeters. They caught it when he was diagnosed with colon cancer. So I just thought it was going to be my journey. After I lost my husband, I realized, as diabetes was just rapidly growing in our population, and it's a food-borne condition that shouldn't exist. And if it does, it shouldn't progress, just like Dr. Caldwell Esselstyn talks about heart disease. I realized at that moment that I needed to give my life more purpose outside of my children as I was trying to fill space in my life. It was an area I decided to dedicate myself to because most people are living with insulin resistance. The need is endless. And it's not just in the United States, it's just throughout the world.
So very dramatic, extreme personal situation brought you to this area, but obviously it's really a global problem.
Mm-hmm.
I'm sorry to hear about all those hardships, and I'm glad you found your way to a path where you could not just find healing, but help heal other people too. The name Empower Me, you didn't choose treat me, manage me, educate me. You chose Empower Me. Talk a little bit about that.
Health does not come with your doctor, does not come when you go visit any healthcare provider, including a diabetes educator. Health is within all of us, and it's in our homes. But there's a lot of noise. There's a lot of confusion. As much as I go after the egg industry, there's a million people who will tell you how healthy eggs are for you. It's my role to help to educate and guide so that people can empower themselves to make the best choices for themselves. It's really not my job to tell people what to do. I want to guide people so that they understand that food is powerful. Moderation is a myth, and it's actually a myth for all of us. I want to empower people so that they understand why certain choices allow our bodies to thrive and why other choices create disease. Unfortunately, chronic disease is growing at rates we've never seen before, especially with our children. Health is in our home, and we have to empower ourselves so we can empower our families to make different choices. And when we do so, it's not just for our health, but it impacts our planet and the animals that we share this space with as well.
Health is in our home. We're both nurses, so we had that professional orientation and training. When I went through my health coaching training, it was so transformative. You move from this concept of handing a patient or a client a list of instructions based on a diagnosis to working to empower them to make choices. That's the only way it's going to be sustainable, is if they make the choices, right? So I love that. The other thing I was thinking about when you were talking before is just yesterday here, I'm in the San Francisco Bay Area. On the front page, the very headline was about a special clinic that they have at UC San Francisco Medical Center now, just to treat younger people with colon cancer, because it is so common now.
Yep.
Jacinda, prediabetes and insulin resistance, those are your specialties. They're incredibly common in midlife women. Most people aren't even aware they have them. When they get diagnosed, they don't realize it's been going on for quite a long time. Tell us what's actually happening in the body, and why does midlife seem to accelerate this or amplify it?
I would say that it used to be midlife, but we're actually seeing it younger and younger. When I work with women as they're getting older, they tell me that they were perfectly healthy, and then just all of a sudden they get sick. That's not really what's happening. Disease is brewing under the surface, and unfortunately, many people still see prediabetes is something that's just a warning for a health condition. But when we live with prediabetes, we can lose up to 50% of our beta cell function. It's a very serious health condition.
For someone who doesn't understand what beta cell function is, can you just briefly explain that?
Yeah, so inside of our pancreas, our beta cells make our insulin, which is a very important protein, a very important hormone that helps us bring our primary fuel, which is our sugar, into our cells, into our muscle, into our liver to be utilized. These beta cells, when our blood sugars are high, get destroyed. We used to think we would lose 50% of that production of this very important hormone when we develop type 2 diabetes. But the data now shows us that we're actually losing up to 50% of that beta cell function while we're living with prediabetes. Most people live with prediabetes for about 10 years, but we don't feel it. We don't feel it when our blood sugars are a little high. 80% of people who are living with prediabetes have no idea. I've lost count how many times I'm diagnosing people with prediabetes who see their doctor on a regular basis. Sometimes nothing is ever said, or their doctor says something like, well, we need to keep an eye. We're just going to keep an eye. But I guess it might be difficult when very little is taught in medical school about nutrition. So no one really knows what to tell their patients, except they get a lot of just eat healthier or move more. But what does that mean? What does that really look like? And so often people go asymptomatic until all of a sudden they're sick, and they think it just happens. But it doesn't just happen. As we start to test younger and younger children, when I work with children, it's very common, like if they're living with type 1 and we do lipids, that they have high cholesterol and high LDL. We're just not tracking earlier because we used to think these conditions were something that happened when we get older. But now we see it across the board. In fact, children born from 2000 on are not expected to live a longer life than their parents.
Yes, we've heard that. That's a really disturbing statistic.
It is. It should give us all pause, and yet it doesn't. We have more medications today for heart disease and type 2 diabetes than we have ever had before. Ironically, every time we have a little bit more medication, the rates of diabetes, the rates of heart disease actually go up. With all these medications, we haven't even flattened the curve, not alone help decrease it. Because when it comes to diabetes, medications on the market for diabetes for type 2 don't treat the cause. They treat the symptom, which is a high blood sugar. And that's why people will think if you eat something like a banana is bad because it makes your blood sugars go up, but it's your body's primary fuel. It is just the symptom of something that's going on. If I can just give like a little analogy so people could understand this. Imagine, you get hospitalized for a lung infection, but you present with a fever. And so the doctor comes in and he only prescribes Tylenol to treat that fever. For a moment, you might look a little better and you might even get a little better for a moment, but you don't actually get better because Tylenol will not treat the lung infection. And so in time, you just get worse and worse. And then the doctor comes in and gives you more and more Tylenol. And it just gets progressively worse because antibiotics were never prescribed to treat that lung infection. This is how we treat diabetes.
That's a great explanation. Do you actually diagnose patients?
I do. Unfortunately, type 1 diabetes and a form of type 1 diabetes called type 1.5 is rapidly growing. So sometimes people actually come to me with type 2 diabetes, and I end up running autoantibodies and C-peptides to find out that they're actually living with either type 1 or type 1.5. Sometimes people come to me who think that they're healthy and they just want to prevent disease, and I find that they have pre-diabetes or type 2 diabetes.
Okay, so I want to back up to help clarify things for someone who's not quite as scientifically oriented. There's a lot of conversation right now about metabolic health. And the terminology for lay people, even if you're not a lay person, it can be overwhelming. Insulin resistance, blood sugar regulation, the microbiome. Can you talk a little bit about those terms for women today who are trying to understand what they mean and why they matter for how they feel from day to day?
Well, they're all interlinked. So first, let's talk about insulin resistance. Insulin resistance is essentially dietary fat that is storing in the wrong places that interferes with sugar uptake into the muscle and into the liver. Our muscles, our liver, our pancreas is not designed to store large amounts of fat. It's designed to store large amounts of sugar. And it stores it in little compartments called glycogen. Sugar is our primary fuel. And in fact, it's so important that your liver is always making it. You'll make about 1 to 2 grams of sugar an hour if you're healthy. And if you're not, you can be making like 5 or 6 grams of sugar an hour. And when we sleep at night, our brain requires a lot of it. So if we're healthy, we're making like 10 grams of sugar at night when we sleep. If we're unhealthy, we're making like 15 grams of sugar when we sleep at night. So most of our diets, including a lot of plant-based diets, are very high in fat. Fat, our adipose tissue, is unlimited. The late Dr. McDougall used to say the fat we eat is the fat we wear. It takes a very long time to burn fat. In fact, if you consume one small fry from McDonald's, it can take, like, depending on your speed, it's continuous exercise for about 40 minutes. And depending on your speed of burpees, for those of the listeners who have ever done a burpee, that could be between like 200 and 800 burpees to be able to burn that dietary fat. So this fat begins to build up, and we know it through imaging and some of the work of Dr. Taylor. He's been doing research on insulin resistance since the 1970s, and they were using MRI imaging. We know this fat begins to pile up in the liver first, then it gets into the muscle, and then it even gets into the pancreas, into those beta cells that we were talking about, and will actually interfere with their ability to produce insulin. As we decrease our dietary fat intake, we can actually see that the pancreas regains the ability to actually produce insulin again. So this is insulin resistance. It's dietary fat stored in tissues where it doesn't belong.
I just want to pause and say that as a nurse who's been a nurse for 40 years, that's a different way of thinking, practicing than what you hear in mainstream medicine, which is that diabetes is a disease of sugar metabolism.
But that's actually changing a lot because we actually, we have 100 years of research on this. And after MRI imaging came out, they were able to infuse people with fat or even feed them orally with fat. And we can see even in healthy individuals that we induce insulin resistance and where this fat is going in as little as 150 minutes. People who don't understand this are not up to date with the science. The science is very clear about what is driving insulin resistance, but it's more complicated than that because we also have medications that create problems. I've had people on Keytruda that their beta cells stop functioning, so different medications can impact things. We know statins cause type 2 diabetes. Now, unfortunately, we knew this in 1997 when Lipitor was launched by Pfizer. At the time, they knew that it caused type 2 diabetes. To date, the mechanism of action is still unknown, but they did manipulate the data and they hid it. It was something like 17 years later, they were actually sued over it. We've got a lot of endocrine disruptors in our world as well. There are some things we can't control, but what we can control is food. We do know that dietary fat induces insulin resistance with just one meal. We also know from, now we're going to talk about the gut microbiome, that a high fat diet decreases beneficial bacteria, increases harmful bacteria, it increases bile tolerant microbes because you need a lot of them to be able to digest all that fat. And it can rapidly, if not with each meal, actually change the diversity of microbes that we depend on for our health. The science around the gut microbiome is relatively new. When we were in nursing school, we were told that fiber, it's a carbohydrate that we cannot digest, that our gut microbes digest, but we didn't know that then. We were told it had one role. Remember what that role was?
To make you poop.
Make you poop. That was it. Had no other benefits. Outside of that, it was just completely useless. Now we know that fiber will feed healthy gut microbes that up and down regulate gene expression. They actually regulate blood sugars by 4 different pathways. They regulate our blood pressure. They make almost all of our neurotransmitters, including serotonin, that happy hormone that gets taken up by the vagus nerve. They do incredible things. And we are not feeding them well. Our ancestors ate well over 100 grams of fiber a day. Now, noted that wild plants are actually higher in fiber, but it doesn't mean that we should be only consuming 15 grams of fiber, which is what the average adult does consume. It's estimated that it's less than 3% of adults and less than 1% of children are eating enough fiber just to meet dietary guidelines, which is not enough to really help sustain and help a gut grow. We've lost our diversity of our gut microbes because of what we're eating. So when we do eat plant-based food and we keep it low in dietary fat, it creates a gut microbiome that is anti-inflammatory and supports the movement and growth of these microbes that determine our health. And when it's the opposite, when we have a lot of animal protein and when we have high dietary fat, it actually grows unhealthy microbes and destroys these beneficial microbes. And all of this is part of our metabolic health. It is all interconnected. The other aspect of our metabolic health is our muscle mass. We won't have time to, go down the rabbit hole regarding osteoporosis, which I think is mostly driven by the pharmaceutical industry. The problems that we have in Western communities like the United States is that we just stop moving. Moving is life. We have all the time in the world to not move when we die. I got to meet a cardiologist over the weekend who knew the people who were doing the research on our current guidelines for 150 minutes of moderate to intense exercise and 2 days a week of weightlifting. She said that that is not what the science showed. And they didn't think that Americans could actually do what they needed to do to be healthy. So they just reduced them without actual science behind it. And we are meant to be moving and we're not. So when it comes to falling and breaking a hip, it's the fact that we're falling. If you look at people in blue zones, they just never stop moving. Many of them squat when they eat. They squat over a hole to use the restroom. I've been in rural communities where I see these elderly people who are walking up, cobblestones and walking upstairs, and they don't have elevators and they're walking home carrying their groceries. Most of us, most of the time, we have food service. I have a neighbor here where I watch them actually deliver McDonald's to their home, and McDonald's is actually in walking distance to my home. So we just don't move. When we really look at bone health, we know it's the fact that we're not exercising. This is what's important for our bones and our muscles. We need to stay away from processed food and salt and smoking. The science also does not support more calcium to actually support bone health either, even though that gets pushed on us because then we have conflicts of interest within the dairy industry beginning in our schools as well. So And that's a whole other avenue to get into. But this is all connected on bone health. And when we look in metabolic health, and when we look at these GLP-1s that a lot of your listeners may be on or thinking about doing, because as women are gaining more and more weight, it's like 78% of our population is either overweight or clinically obese. Special note, in the year that I was born in 1970, there wasn't a state that had obesity rates over 20%, not one. Today, we don't have a state that has obesity rates less than 20%. You know, this is not evolution. This is what we're doing with our lifestyle in our society. So when it comes to supporting metabolic health, more drugs will lead, you mark my word, they will lead to more disease with these weight loss drugs and more obesity long term. They are not the solution for lifestyle driven conditions. And we lose about 40% of our muscle mass, which leads us to our metabolic health. Without proper muscle mass, we can't actually reverse diabetes. I've worked with people where they've lost a whole bunch of weight all at once, and all of a sudden their BMI is really optimal, like 21, 22, but yet we can't reverse diabetes. So when we do body scans, like DEXA scans, I had one lady that was super skinny, but she was 58% body fat. And it had been from yo-yo diets and then being on GLP-1s. Without muscle mass, we can't be healthy. And we don't have to be bodybuilders. We have to be moving. And we should be thinking about every day how we're choosing to live life. Every day should be movement. As I am getting into my 60s, I just moved into a home that is 4 stories, no elevator.
So that's great. You'll be doing a lot of stair climbing.
Yeah, right.
I know my listeners can now see how impressive you are with your scientific background and knowledge and how you express it in a way that's so relevant. But you touched on a few things that hit me personally. I consider myself super healthy. I've been plant-based for 8 years, lifestyle medicine certified, but I happen to have high lipo(a) and high ApoB, and so started to see a cardiologist who put me on Lipitor. I didn't tolerate it, so I'm currently off of it. I will have to talk to her about the incidence of diabetes type 2 with statins. I have genetics of osteoporosis and I have a diagnosis of osteoporosis. I'm a small woman and I'm more at risk of it. I'm on medications for osteoporosis too. It's so hard to curate the information out there and to find medical providers and people that you can trust, because people aren't up to date with a lot of the evidence-based practice and research.
Yeah, so let's touch on a couple of these things because they're very important. I have a very high Lp(a). That was something we weren't even testing before. But just because you have a genetic predisposition, I completely reversed everything. I wouldn't be on a statin because I want to prevent something because I have a high Lp(a), or if I had pre-diabetes, or if I had diabetes and I hadn't had a heart attack. All these medications, all they do is shift on the plate something else is going to harm us. They are not the solution. Our chronic diseases are foodborne, and often a lot of normal aging conditions, as we lose muscle mass and we lose bone density. Where's the difference between normal aging and the fact that we're not moving the way we should be, right? If you want to take a deep dive, go into Dr. Greger's videos on osteoporosis and the treatments. He's done quite a few really exceptional videos on that. So you can weigh the benefits versus the risks. When we look at statins, Dr. Caldwell Esselstyn did a great review of a study that was published in 2019 out of a British medical journal. They took like 97,000 people for primary and secondary prevention taking statins. And we know that they lower total cholesterol, and we know that they lower LDL, but how much longer do you live? I mean, isn't that really important? I mean, if you don't live longer, who cares if your LDL is lower? And essentially, that's what this study found. is they found, compared to taking nothing, people doing it for preventative, I don't have the study in front of me, but I believe for preventative, for primary, you live 2 to 3 days longer. And for secondary, meaning you've already had a heart attack, it was really shocking. It was like 4 or 5 days longer. It wasn't 4 or 5 months longer. It wasn't 4 or 5 years longer. It's important to understand when the data is actually presented, including to the committees who make recommendations for what medications are needed, and when most studies are now completely controlled by pharmaceutical industries that also determined what data anyone sitting on these committees will review for the recommendations as well. But there's a difference between absolute and relative risk reduction. And they will use relative risk reduction. I'll just give you an example. Out of 100 people, 3 people will have a heart attack. And if you take this drug every day for the rest of your life, then 2 people will have a heart attack. But they don't tell you the 100, because that would be a 1% reduction, right? And a 1% reduction, you may think, well, I don't know if I want to take this. As a consumer, that you have a right to understand this so you can make an informed decision for yourself with the guidance of your doctor. But that's not the information we get. We get relative risk reduction. So they reduce it to 3. And they say 3 people will have a heart attack. You take this drug every day, now it's 2 people. It is a 33% relative risk reduction. Sounds pretty good, doesn't it? You're like, oh, okay, that might be important for me. So I think that we complicate being healthy.
This conversation was so rich. I am bringing it to you in 2 parts. You're in part 1 today. Part 2 drops Tuesday. Jacinda Shapiro, everyone. EmpowerMe Diabetes Health. What I keep coming back to is how simple her framework actually is once you strip away all the noise. Move every day, eat plants, keep dietary fat low, sleep, stay connected, fiber up, fat down. It's not complicated. It's just countercultural. If today's conversation sparks something for you about your own metabolic health and you want support actually applying it to your life, the Sexy in Your 60s coaching experience is where we do that work together. The next round starts June 1st. If you want in, now is the time. Go to sexyinyour60s.com. If this episode resonated with you, share it with a woman who needs to hear it. Subscribe if you have not, and leave a review if you are willing. It helps more women find this show. I'm Dvora Citron. This is Sexy in Your 60s. See you next Tuesday. Thank you so much for spending this time with us. If today's conversation resonated with you, I invite you to take the next gentle step by downloading the Sexy in Your 60s Starter Guide, a free resource designed to help you reflect on what supports your energy, vitality, and sense of connection in this season of life. You'll find it linked in the show notes or at slant2plants.com/starter-guide. You can also explore more of my work, including health coaching, plant-forward nutrition, and resources for vibrant living at slant2plants.com. And for the ultimate transformation, join the Sexy in Your 60s coaching experience at sexyinyour60s.com. If this episode spoke to you, please consider following the podcast, leaving a review, or sharing it with someone who might need it right now. That's how these conversations continue to grow. Until next time, take care of yourself, stay curious, and stay boldly, beautifully sexy, exactly as you are.